And let's look at some of the symptoms that you may feel that could lead to arthritis, or at least to look out for that matter. So let's look at this graphic, and the first one is pain in joints that doesn't go away. It's just that constant pain, right?
So that's one of the classic symptoms of arthritis. If it progresses far enough where you get the joint is rubbing or bone on bone, where the cartilage has actually been wasted away completely, and you get bone on bone friction, there's going to be a constant inflammatory process going on in that joint. So for example, in the shoulder joint. And one of the classic symptoms is constant pain. So it can be pain with activity or pain at rest. And that's something that's very common with arthritis.
Bullet point number 2 would be warmth and redness in joints.
So warmth and redness, obviously, like I just mentioned before, there's an inflammatory process going on because of all the friction and the degeneration that's going on at the joint where, you know, two bones meet. And, you know, obviously swelling, redness, and things like that would be also pretty common presentations that we see at the clinic.
Let's combine these two, swollen joints and stiff joints.
So swollen joints, going back again, inflammatory process going on, but stiffness of the joint is a very common presentation. As you get wasting away of the cartilage in between the joint, and there's degeneration in the actual joint and the bones that are opposing each other at that joint, you start getting a lot of guarding of the soft tissue around the area, and the actual joint starts becoming more and more stiff. So obviously you start losing range of motion, mobility, and that starts limiting you in everyday life, obviously.
Trouble moving joints in a normal way and grinding feeling of joint when moved. Oh, that sounds so painful.
So that's, you know, usually you see that with arthritis, usually in the more advanced stage, but that's also medically termed crepitus. And crepitus is where you get friction of two opposing surfaces, and you actually hear, you know, if the patient's actively moving their shoulder, for example, or you're moving their shoulder, you'll actually hear clicking, snapping, and clunking type noises. And that's just friction that's going on in the joint. And obviously a lot of times it's very painful for the patient.